Well, here's another broken promise. The White House said only the rich were going to pay more for Obamacare, but now a new study saying middle-class workers will see their income take a hit because of the law. So, Steve, what's all this about?
What it's about, David, is that under this, the way Obamacare actually is being implemented, is that the middle class is going to end up paying more as well. The Brookings Institute found that the bottom 20% will get an effective income increase of 6 to 7%, but the middle class is going to be anywhere from 1 to 3% poorer for it because of the higher pay. They're going to have to pay more premiums in terms of what they get for insurance. So it's not just the upper income, it's the middle incomers as well. 80% are taking a hit, 20% are getting a favor.
And, Rick, we can be very specific when we say middle class about what we mean. $21,000 to $40,000 a year, they'll pay more. $40,000 to $65,000. I think that's solid middle class, don't you?
Yeah, I do. The study, if it's correct, is a little bit disturbing. I have to say, I read it. But here's something that you have to keep in mind. The study itself notes that there was a whole lot more things left to come, a lot of shoes to drop, and they qualified it. Then, when you take the results of the Brookings study and you match it to some of the economic principles to result from the CBO study, it gets really confusing because they're directly opposed. Guys, like it or not, and I know you don't, it's going to be 3 years until we really begin to know what worked and what didn't.
Well, Mike, the fact is we have already seen stuff happen, and it's not very encouraging. Millions of people losing their plans, premiums going up, a lot of people shoved off to the federal dole through Medicaid, and the president said the middle class wasn't going to have to pay for this. In fact, he specifically said the middle class will realize greater security, not higher taxes. But if you're paying more of your money for something, isn't that a kind of a tax?
Just another one of President Obama's lies when it came to Obamacare, David. Look, what we've known for a long time and what's not subject to debate is that Obamacare is first and foremost about the redistribution of wealth. The president tried to sell to the public that it was only going to be the richest people who were going to have money taken and redistributed. Now it's coming out that it's actually going to be the top 4/5 that's going to have money taken and redistributed. That's a very, very bad thing on the overall economy.
And, Bruce, the bottom line, as we've always said here, is you can't get something for nothing. And that's what the president was promising. What this study says is, in fact, it is going to cost. And it says incomes fall as employers devote a larger share of their compensation payments to health benefits. So, in other words, the bosses will pass it on to the workers, and that's why the middle class will suffer.
Well, I think you point out something interesting in the fact that this has become more a part of people's income and people's total package, if you will, their employment package. I think in the long term, I think it's going to improve people's income because they're going to have flexibility with their jobs and so forth. And we're having a period right now of health inflation that's at a 50-year low the last 3 years. And I think anybody who's had private insurance has seen their income, their raises wiped out by double-digit health care cost increases, and we haven't had that.
Well, John Tammy, prices have come down in health care over a 3-year period, but if you just look at what's happened since October, people have seen their health care prices go up.
Well, no question it's going to hit middle-class incomes, and it will because Obamacare is a big burden on businesses, and it's going to reveal itself in lower salaries. There's this naive perception among some in the electorate that President Obama could offer all of these things and they'd come to us for free. But I think what people are realizing is that compassionate government is very expensive and will be paid for by all of us.
Sabrina, there's no such thing as a free lunch, and if a politician says it, the first thing you do is reach for your wallet, right?
That's right. I think John's onto something. There's two important things that come out of this study in my book. One is that Obamacare didn't tackle one of the most serious parts of our healthcare system, which is that our healthcare is tied to our place of employment. So we have this massive new program, and what do we see? We see a loss of income, a loss of jobs, rather than people owning and controlling those healthcare dollars. The other problem is that we're finding that people are finally waking up to what is income. And I think Henry Aaron at the Brookings Institution does a great job of pointing out that your income is more than your wages. And when people see all of these parts on the table, they're going to be more willing to say, hey, I want a little more of this and a little less of this. And John's exactly right that all of these benefits don't just come out of thin air.
Steve, we only have 10 seconds, but bottom line is it ain't just the rich that are going to pay for this, is it? The middle class is going to get stuck with the big part of the bill.
David, the middle class is where the real money is in this country, so when they talk about these schemes, they're going to get hit one way or the other. The rich don't have enough to pay for it all.
Last word from Steve Forbes coming up
We have not massively expanded the welfare state. That's just not true.
Now, you heard what the president told our Bill O'Reilly. Now get ready to hear what the facts say on Cashing In. They report, you decide at the bottom of the hour. But first, suckers and cookies. Now, both treats that kids love to eat, but these goodies are laced with marijuana. Is it high time to ban them to protect our kids?
Rocky Mountain High, Colorado. Rocky Mountain.